You cannot shrink your enlarged prostate if you take this medicine. Are you struggling with an enlarged prostate and searching for the right solution? Beware, what you're taking might be doing more harm than good. Welcome back to Healthy Habitat, where we dive deep into health issues that matter most to you. If you're dealing with an enlarged prostate, you've likely experienced symptoms like frequent urination, especially at night, difficulty starting and maintaining a steady stream of urine, or even the uncomfortable feeling of not fully emptying your bladder. These symptoms can seriously impact your quality of life, leading you to try various treatments in hopes of finding relief. But what if I told you that some of the medications you might be relying on are actually preventing your prostate from shrinking? Yes, you heard that right. Despite their widespread use, certain medicines could be the reason you're not seeing the improvements you expected. In today's video, we're counting down the top 7 medicines that could be standing in the way of your recovery. Stick around until the end, because number 1 on our list is the most common one that many men unknowingly continue to take, thinking it's helping them. Let's get started. Number 7. Antihistamines. Antihistamines are widely used to combat allergic reactions, whether it's for seasonal allergies, hay fever, or even cold symptoms. These medications work by blocking the action of histamine, a substance in your body that causes allergic symptoms. While they are effective in relieving symptoms like sneezing, itching, and runny nose, they can also have unintended side effects, especially for men with an enlarged prostate. The issue with antihistamines is that they can reduce the ability of your bladder to contract. This reduced bladder contraction means that it becomes more difficult to fully empty your bladder, leading to urinary retention. For someone with an enlarged prostate, this is particularly problematic because the prostate can already be restricting the flow of urine. Adding the effects of antihistamines into the mix can exacerbate the problem, causing more frequent urges to urinate, difficulty starting urination, or even painful urination. If you rely on antihistamines regularly, especially during allergy seasons, it's important to weigh the benefits against these potential risks and consider speaking to your doctor about safer alternatives. Number 6. Decongestants. Decongestants, such as pseudoephedrine, are commonly found in over-the-counter cold and flu medications. They work by narrowing the blood vessels to reduce swelling in the nasal passages, which relieves congestion. However, this same action can also cause the muscles around the urinary tract, including the urinary sphincter, to tighten. For men with an enlarged prostate, this can be particularly concerning. The tightening of the urinary sphincter makes it more difficult for urine to pass through the already narrowed urethra, leading to symptoms such as difficulty in starting urination, a weak urine stream, or the sensation of incomplete bladder emptying. In some cases, it might even cause acute urinary retention, a condition where you suddenly find yourself unable to urinate at all, which is a medical emergency. Given these potential side effects, it's crucial to avoid decongestants, or at least use them with caution if you have an enlarged prostate. Always check with your healthcare provider before using these medications, especially if you notice your urinary symptoms worsening during a cold or flu. Number 5. Antidepressants. Antidepressants are a lifeline for many people, helping to manage depression, anxiety, and other mental health conditions. However, certain types of antidepressants, particularly those that influence serotonin levels, can have unintended consequences for prostate health. Medications like selective serotonin reuptake inhibitors, SSRIs, are known to impact the nervous system in ways that can interfere with the normal functioning of the bladder and prostate. One of the main issues is that these antidepressants can relax the bladder muscles too much, leading to a condition known as urinary retention, where it becomes difficult to fully empty the bladder. For men with an enlarged prostate, this adds to the challenges they already face, as the prostate is naturally causing a narrowing of the urethra. The result can be increased difficulty in urinating, a more frequent need to go, and sometimes even painful urination. It's also possible for these medications to reduce the sensation of urgency, meaning you might not feel the need to urinate until your bladder is very full, which can increase the risk of bladder infections. If you are on antidepressants and struggling with these symptoms, it's important not to stop the medication abruptly, but rather to consult with your healthcare provider. There may be alternative treatments for depression that don't have the same impact on your prostate health, or adjustments can be made to manage the side effects better. Number 4. Diuretics. Diuretics, often referred to as water pills, are commonly prescribed to help manage conditions like high blood pressure, heart failure, and certain kidney disorders. They work by helping your body eliminate excess sodium and water through urine, which can reduce the amount of fluid in your blood vessels and lower blood pressure. While this might sound beneficial, particularly for people needing to reduce fluid retention, diuretics can have a counterproductive effect for men with an enlarged prostate. The primary concern with diuretics is that they increase the frequency of urination. While this might seem like it could help flush out the bladder more regularly, it can actually cause your bladder to overwork. This frequent urination can lead to a condition known as overactive bladder, where you feel the urgent need to urinate more often, even if your bladder isn't full. For men with an enlarged prostate, this can exacerbate symptoms like urinary urgency, frequency, and incontinence. Furthermore, as your bladder becomes more irritated from the constant need to empty, it might start to contract uncontrollably, leading to an inability to hold urine. This is particularly troublesome at night, resulting in frequent trips to the bathroom and poor sleep quality. If you're on diuretics and notice these issues, it's important to discuss with your doctor whether the dosage or type of diuretic might be adjusted, or if alternative treatments for your underlying condition might be more suitable. Before we move on to the next medicine, we wanted to let you know that we have posted the Amazon links for all the recommended prostate supplements in the description and comment box below. Make sure to check them out for convenient and reliable options to support your liver health. Number 3. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen, aspirin, and naproxen, are widely used to relieve pain, reduce inflammation, and lower fever. They're a go-to remedy for everything from headaches and muscle aches to arthritis and injuries. However, when it comes to managing an enlarged prostate, these common pain relievers can pose some unexpected risks. The issue with NSAIDs lies in their potential to interfere with the medications typically prescribed to manage prostate enlargement, such as 5-alpha reductase inhibitors or alpha blockers. Some studies suggest that NSAIDs can reduce the effectiveness of these treatments by altering how your body processes them. This means that while you might be taking medication to shrink your prostate or ease your urinary symptoms, NSAIDs could be diminishing their benefits, making it harder to achieve the desired results. Moreover, long-term use of NSAIDs has been associated with an increased risk of kidney damage, which is another concern for men with prostate issues, as both the kidneys and the prostate play crucial roles in the urinary system. Regular use of NSAIDs can also increase blood pressure, which is particularly problematic for men already on diuretics or other medications for high blood pressure. If you rely on NSAIDs for chronic pain or inflammation, it's essential to consult with your healthcare provider about potential alternatives or strategies to mitigate these risks while managing your prostate health effectively. Number 2. Testosterone supplements. Testosterone therapy is often prescribed to men with low testosterone levels, a condition known as hypogonadism, which can lead to symptoms like fatigue, decreased libido, and loss of muscle mass. While testosterone supplements can be beneficial for restoring energy levels and improving quality of life, they come with a significant downside for men with an enlarged prostate. Testosterone is a key hormone involved in the growth of the prostate gland. When you take testosterone supplements, it can stimulate the prostate, causing it to grow larger, which can worsen the symptoms of an already enlarged prostate. This is because the prostate is highly sensitive to testosterone and its more potent form, dihydrotestosterone, DHT, which directly influences prostate growth. Increased levels of these hormones can lead to further enlargement of the prostate, exacerbating urinary issues such as difficulty in starting urination, weak urine flow, and frequent urination, especially at night. If you're considering or currently on testosterone therapy and have concerns about your prostate, it's crucial to have regular checkups with your doctor. They may recommend frequent monitoring of your prostate-specific antigen levels and the size of your prostate to ensure that the benefits of testosterone therapy outweigh the potential risks to your prostate health. Number 1. Alpha blockers. Alpha blockers are a class of medications commonly prescribed to treat high blood pressure and symptoms of prostate enlargement, such as difficulty in urinating. They work by relaxing the muscles around the bladder and prostate, making it easier to pass urine. However, not all alpha blockers are the same, and some may not be the best choice for men specifically dealing with an enlarged prostate. While alpha blockers like tamsulosin, commonly known by the brand name Flomax, are designed to target the prostate specifically, others, such as doxazosin and terazosin, are more generalized in their action and can affect blood pressure levels more significantly. For some men, this can lead to unwanted side effects like dizziness, fainting, or a sudden drop in blood pressure when standing up, a condition known as orthostatic hypotension. The most important point to understand is that not all alpha blockers are created equal. If you're taking an alpha blocker that is not prostate-specific, it might not be as effective in managing your symptoms of an enlarged prostate, and you might experience more side effects. Therefore, it's essential to work closely with your healthcare provider to ensure you're on the right type of alpha blocker for your specific condition. In some cases, your doctor might recommend switching to a more targeted medication to improve your prostate symptoms with fewer side effects. These detailed explanations highlight the complexities and potential risks associated with these medications, emphasizing the importance of carefully managing your health under the guidance of a healthcare provider. So, there you have it, 7 common medicines that could be standing in the way of shrinking your enlarged prostate. From antihistamines to alpha blockers, each of these medications has the potential to worsen your symptoms or counteract your treatment efforts. It's essential to be aware of what you're taking and how it might be affecting your health. If any of these medications are part of your daily routine, it's worth discussing alternatives with your healthcare provider. Remember, managing an enlarged prostate isn't just about taking the right medication, it's about taking the right approach for your individual needs. Thanks for watching, and if you found this video helpful, be sure to hit that like button and share it with others who might benefit. Don't forget to subscribe to Healthy Habitat for more tips and insights on how to take control of your health naturally. Also, we've made it easier for you to start your liver detox journey by posting the Amazon links for all the recommended prostate supplements in the description and comment box below. Check them out for convenient and reliable options to support your prostate health. Together, we can help you live a healthier, happier life. Stay informed, stay healthy, and see you in the next video.